Hi, welcome to Light Up with Shua. My guest today is Dr. Joe Fitzpatrick, and I think you will enjoy our conversation with him. Hello, Dr. Joe.
Good morning, Shua.
How are you?
Good, thank you.
How was the day today? Seems like another nice day.
Yes, spring is coming.
Oh, that's good. It's hopeful. Can you tell me your full name and what do you do?
Okay, my name is Dr. Joe Fitzpatrick. I'm a chiropractic physician. My practice is located in Acton, Massachusetts, where I've been for the last 29 years now. I grew up in Bergenfield, New Jersey. Went to chiropractic school out in Los Angeles and ended up here in Massachusetts.
Oh, wow. Lots of travel, huh? Mm-hmm. We won't get into how did you go to California and why did you come to Boston area or greater Boston.
Okay.
So, but thank you. Thank you for coming here.
Oh, you're welcome.
So could you tell me about your, why did you choose this field, this career, and what can you advise to the young people who are thinking about coming into this field?
So I started in working in healthcare. I worked in hospitals when I graduated from high school. I was a respiratory therapist for about 8 years, and I loved just being around patients and working in the healthcare fields. Decided to go back to school for my Bachelor's of Science degree as a pre-med student, and I had a good friend of mine who talked about chiropractic, and I really didn't know a lot about it at the time, but I liked what he had to say about it, and I did some of my own research, talked to a lot of chiropractors in New Jersey where I grew up, and it looked like a wonderful profession to get into.
So you started kind of a research into it?
Yes.
After, okay.
Yeah. I talked to chiropractors in the area. I went and knocked on a few doors, and I didn't know a lot about it at first, but as I did more research, I liked the curriculums in the schools, how they were set up, a lot of science classes, and I heard a lot of good things from all the chiropractors.
So what about, did you like to be, some people don't like to be close to the patients so much because you really have to be, maneuvering them around, so it was comfortable for you?
Yeah, you have to be. The word chiropractic means done by hand, so you have to be
okay.
open to touching patients and
Okay.
being able to put your hand on them and trying to help them.
Yeah. So did you get a feedback in the beginning when you were, I'm sure you also have residency and internship kind of time before you become a full chiropractor?
Right. The curriculum was a 4-year program, but then you had to do a year of internship,
okay.
where you did have to treat patients in a
Okay.
clinical setting.
Okay.
And so that's when you really get to know. I think with my background working with patients already, I was already pretty comfortable doing that, but it was different.
So what was the real attraction towards this field? Is anything that you can share with us?
Yeah, I think what I liked about it most was the holistic approach to treating patients. Coming from a more medical background, it was nice to find a profession where we weren't using drugs or surgery to manage patients. I liked the more holistic approach, and I also like the idea of having your own business and your own practice.
So it's your own practice now?
Yes,
okay.
it is.
But how did you start? Do you start with your own practice or do you work with hospitals?
Right. So when I came out of chiropractic school, I started working with another physician, another chiropractor, and my plan was to work with him for a few years and get some experience and then open my own practice. Fortunately for me, he left the practice and sold me the practice, so I didn't have to go anywhere. It was already established.
Okay, that's good.
Yeah.
That's good. So what would you advise someone who is thinking about becoming a chiropractor or exploring this field? What's the best way to get into it, to explore if you should go into it or you shouldn't? What type of person or what type of field it is that you should say, well, if you are this way, then go for it, and if you're not, then don't even try it? Any
Yeah, I mean, you have to be good
highlights?
working with patients who are in a lot of discomfort sometimes, so you have to be able to handle patients being in pain and being sympathetic and being able to help them beyond that. It's hard because some people are afraid of that. You certainly have to be willing to touch patients and
comfort them.
and try to deal with some of their problems.
Okay. And keep the professional distance and all the balance and
Exactly,
all. Right.
exactly.
Okay. So are there, have you ever faced any awkward situations where somebody misinterpreted your comforting, your being a man? Nowadays we are...
No, not really. I have 4 women who work in my office with me, and if I ever do, I always talk to them, but if I ever have an encounter with a patient that I think is going to be uncomfortable, I may have them step in the room with me,
okay.
or let them know.
So you have your
just so, you know, everybody's kind of watching each other and making sure everybody's comfortable with what we're doing.
Good, good. Thank you. Thank
You're
you for
welcome.
that. Any other advice for the youth? How to explore this career?
Yeah, you know, chiropractic in general is still growing all the time.
Yeah.
We're seeing more and more patients all the time. It's more accepted by the communities, by the
insurance companies.
Insurance
also,
companies are paying more and more all the time.
Okay.
Although insurance has gotten trickier over the years, but they still all cover chiropractic, whether it's...
And there's more acceptance for this kind of treatment?
I believe so.
Yeah.
People are more open to doing more holistic and natural approaches as opposed to going for surgery or taking medications all the time, which don't seem to fix the underlying problems all the time. A lot of times they just treat the symptoms. I think chiropractic is unique in that we do treat more of the underlying causes as opposed to just treating symptoms.
Good, good. So who treats you?
I have my own chiropractor.
You
I
have
just
it?
saw
Okay.
him this past week, and we've been taking care of each other for years, and we
Oh,
trade
nice.
off. I treat him, and
So
he treats me.
chiropractors do need treatment
Absolutely.
as well? Okay.
Absolutely.
Okay. Now let's come to some parenting. I know that you have a son. And how old is he?
He's 16.
16. Oh, so is it challenging?
Oh yeah,
Is it?
absolutely. He's
What are the challenges?
Oh gosh, well, he's a teenager,
Okay.
but he's a good teenager. I'm very fortunate. But you know, he's turning into a young man, and so that's part of the challenge. But so far, we've been able to
So you have a good
get
relationship?
through it. I think so. We're pretty close and connected. So
Okay, okay. And what type of father are you in your eyes?
a great father. No,
Okay, good, good.
it's hard to say that,
Yeah.
but I think I'm doing a pretty good job.
Okay,
He seems to be happy and healthy and
okay.
progressing.
Communicates with you?
Just the one. So-
Okay.
oh, how many?
Yeah, no,
Yeah,
does he
yeah, just-
communicate with you?
Oh, does he communicate?
Yeah,
Yes,
like
yes, he
often,
does.
or is he close to you?
Yep.
Okay.
I think so. I'm
Okay.
very involved in his day-to-day activities. He plays sports, and I'm involved in some of that.
Okay.
He communicates with me every day on text messaging, and
Is he at home?
He's at home with us.
Okay,
Yes.
okay. So how do you involve yourself with his activities?
Well, up to a few years ago, I was one of his baseball coaches,
Oh, okay.
and so I was part of the team as well, and close in the dugout with him. And but now it's from more of a distance. But you know, I still drive him to practices and games, and go to many games as I can. So pretty involved with it.
Is he interested in your profession?
That's a good question.
Yeah.
I think he definitely likes sciences
Uh-huh.
and in high school, and so I think he might tend to lean towards some kind of medical profession.
Okay, but not exactly becoming a chiropractor. Has
No.
he ever mentioned or expressed to you anything about it?
No, not yet.
Not yet.
Not yet.
Does he say, "Well, your job is good, exciting, boring"? Anything?
He'll ask me questions,
Okay.
and sometimes
Explores.
I'll share experiences that I have, about patients, certainly with
Do you want him?
confidentiality.
Do you want him to become?
I would be
chiropractor?
overjoyed if he
He becomes-
wanted to follow
Oh,
me,
okay.
but certainly I need him to follow his own
Right,
path as well.
right.
So.
And why would that be? Why would you be happy that if he follows your path? Why? What is that?
I think it's a compliment.
oh,
I,
is it?
I think it's he appreciates what I do and what I've done as an adult. And
It assures you
yeah, absolutely.
as a parent,
Yeah.
as a father.
Yeah.
Okay. But if he doesn't do that, that's fine too,
That's fine.
right? It's
absolutely.
not like
No.
okay. Okay. How do you see? So, do you know how he sees you? Like, I understand that he is comfortable, and also you spend enough time when he was younger. were you involved with his day-to-day when he was younger?
I think so.
Does that make a difference in your view?
Absolutely.
Because I'm sure you meet many parents too, right?
I do.
So do you have any suggestions or something that you did and you see some people missing, not to be judgmental, but just to give an advice that, yeah, I have seen that over the years, or, this is a good parenting skill or tip.
Right. Well, I think it's really important just to stay involved. I only have the one child, so I only get one chance. So I try to do as many activities as I can with him. I'm very fortunate because my job keeps me at home. I don't travel. I don't have to go to conventions and things like that. So I come home every night and I'm there every morning. So I'm with him on a day-to-day basis. Yeah.
So that means to be there for your children.
Yes.
One of the things. I assume, but I just want to still ask, are you a good listener? Do you listen to your son?
I believe so.
Or do you mostly delegate or order?
No, I'm more, how do I say
or does he delegate you or
No,
order?
I let him lead the way sometimes.
Okay.
I don't, it's not hard and fast. I like to listen to see what he says. He's a human as well, and I think understanding him and listening to him is so important.
So do you think that is important?
Absolutely.
How important is it? Like listening and being involved, letting him take the lead?
Extremely important. I mean, I can learn from him just like he can learn from me. Absolutely.
Okay. You believe in that?
I do.
Okay. Anything that you learn over the years that you feel that you can share? Anything, if you can, comes to you quickly?
Yeah, I think it's important to give him his own space too, and not crowd him, and let him develop as a young adult, or even as a child. Not to try to dictate everything or to be so close that he can't breathe. Let him find out his own things on his own, but kind of guide him. I always try to lead by example. I think that's a great way to parent. And I see that rub off on him at times, which is humbling for me.
So yeah, you're not the type who wants to know every moment, like what he's doing, what he's thinking, where is he going, who is he meeting, that kind of. If you had a daughter, would you be the same way, or?
I think so. Maybe a little more protective. I mean, I think that's normal. But I don't have to worry about him when I'm not with him. He's a pretty confident boy that I think he doesn't get into trouble.
I'm asking all this because I have these, so many stories and cultural stories about, some parents get too involved, affect their children so much that the children or their adolescent or adult children can't even function, they're so watching them. So it makes it, so that because it affects their decision making and their, what they like or what they want or become an individual, so that's why I was asking.
Well, I think it's important to listen to cues from them too. I think there's times where you do have to be very close and a participant, but there's times where you have to step back and he'll tell me and I'll listen,
Oh, okay, that's good. So he has or you have the capacity to listen when he says, please back off or give me some space.
For example, we were talking about college next year.
Okay.
And he has to start looking at colleges and things like that. And we started talking about had that conversation early, and he basically said, Dad, step back. I want to enjoy high school. I know I have to do that next year, but I want to enjoy what I'm doing now.
So when he said that, how did you feel? Did you feel like, why did he say?
A little bit at first,
okay.
But then when I sat and thought about it, I was like, okay, he needs to grow and he needs his space, and we don't need to rush it, and just take a breath,
Yeah. Good.
Yeah.
All right. Anything else you want to give? Any last tip before I move to another set of questions?
Just as far as parenting, lead by example. I find if you do a good job and you live life properly, he will too. And also just have a good balance where you are involved and not just like working all the time and doing your thing and he's doing his thing.
Should you consciously decide, like did you decide, or should parents if you are not willing to have children, do you think just because you are married and can have children, should you have any suggestion in that?
I think everybody should have the opportunity if they want to do that.
Yeah.
It's not an easy task, as
Yeah.
you know, and I think everybody can be a parent, but not everybody can be a good parent, I guess.
Yeah.
I don't know.
Yeah. Yeah, biologically,
Yeah,
right?
yeah, exactly.
Everybody, can, most
Yeah.
of them, not everybody can be actually biologically, but because I was thinking like not every parent really equips themselves or they're ready for it, and because once
Right.
they are like, oh my God, what what we have gotten
Absolutely.
ourselves into it, and then, anyways, okay. Let's move to some questions that are not parenting, but something like, okay, what are the things that money can't buy, in your opinion, or in your experience?
Well, happiness,
Okay.
certainly. I think there's other things in life than money we need it. We need it to survive and to pay our bills and eat.
Yeah.
But it's not the end all and be all. Other things have value in our lives, whether it's, having friends and family and relaxation
Yeah.
and things like that.
What makes you happy?
I'm not sure. I mean, I love being around my son and doing things.
Uh-huh.
I try to have that balance at home, even with my wife too.
Yeah.
I like taking vacations and
Yeah.
relaxing and having that downtime as well as
Yeah.
the time with my patients. I mean, my practice is wonderful.
Okay.
I love going there every day, and I feel great when I leave. I'm very fortunate.
That's good.
Um,
Maybe that's part of your happiness.
So taking care of patients is part of my happiness. Being a father, being a husband, being a friend.
So what does happiness mean? Do you think it's like you feel fulfilled at the end of the day? You feel like, okay, looking forward to come next day, is that happiness?
It makes you feel good. It makes you feel safe. It makes you look forward to your next adventure, or whether that's work or...
I hope you're happy to be here.
I'm happy to be here today. Thank you.
Right?
Yeah,
We
sure,
should make sure that
absolutely.
whatever we are doing, we're not enforcing something
Right,
on
right.
each other, right?
Right, no, of
There is no
course.
compulsion in religion, and there is no compulsion in our actions every day, right?
It should be comfortable.
Yes, yes. Okay, good. So, what's to live a healthy, fulfilling life then, in your view? Is enjoying what you do means what? Like, give me some
Well,
nice big.
I think that's important. I mean, your vocation and your profession, that's what makes up a big part of you. I think there's professions where you can make a lot of money, but you may be miserable.
Yeah.
There's professions
That's
where
what I
you...
wanted to say, because some people are not enjoying their work, but they're still
Exactly.
doing it. So
Yeah.
what should they do?
Well,
Leave? Find some options?
Maybe. I think some of that can really burn us out if we're in a position where we're not happy with what we're doing, even though it may pay us a lot. But like you said, money is not happiness all the time.
Yeah.
And then there's some professions that are very rewarding and fulfilling, but they don't make a lot of money for you, so you may not be able to survive. You struggle, and that's stressful as well. So somewhere in between, for sure.
So how do you feel that, I don't see you a very pessimistic or negative person, whatever my experience is with you, but obviously it's our professional experience also. But what is the best way to move yourself out as a doctor over the years you are experienced, to get out of depression or negative thoughts, or when you go down, like, is it important to go down, but then how do you come up? Like, how do you get out of that situation, that feeling that you have?
Right. For me personally, I think I try not to hold on to things. So if there is a negative experience or something that brings me down, it doesn't last, fortunately. I think I'm able to kind of turn it around and look for the next positive thing and kind of keep moving forward.
How did you learn to do that?
I have
Do
no
you know?
idea.
Yeah, that's the thing, right?
Yeah,
Oh, that's good. But
exactly.
that's how you have been doing for how long? Like, is it a recent thing? Is it
No,
always been?
I think it's been my personality for a long time.
A long time.
You know?
Okay. Were you a depressed teenager?
No.
No? Okay.
I had
Must
so
have
much fun.
started in teenager.
Yeah,
maybe. Yeah.
I had a great
Yeah.
childhood.
Okay. Okay. Oh, that makes a difference.
Yeah.
Your parents were stable and balanced with you.
I have 5 siblings,
Okay.
and we all had a lot of fun, and we're all still very close. And
Must be the parenting.
yeah, it must be the parenting. Actually, they did
Maybe
a great
conscious
job.
parenting,
Yeah,
right?
absolutely.
Okay. All right, let's get to a couple of questions before I get to last leg of questions about relationships and marriage. How do you maintain your relationships? Is there any tip that you're still married and you have good relation with your patients and your siblings?
I think you have to work at it. Nothing comes automatically, and if you neglect things, they kind of go away. Whether that's your marriage, whether that's a friendship, even a patient reputation, relationship. If I don't listen to them and I don't address their needs, then they're going to leave my office and go somewhere else. So it's important to have that.
So you have to work at it means something. What do you do? Like, if you don't like something about them, do you work it out? You talk to them? Depends on the person. All of the above.
Yeah, I would say one of my weaknesses is that I avoid conflict if I can. So I will talk it out to a point, but I don't know. I guess just working at trying to make it better all the time, paying attention to it is important.
So that comes to another question that I should have asked, and now I can ask you. One of the weaknesses is that, what are your strengths?
Good listener, I think. Compassion.
Okay.
I have to be, as a chiropractor, to help heal my patients, understanding them, being in the moment with them, not thinking about other things while I have them in my treatment room. And as far as weaknesses, like I said, I'm not great on conflict, but I think I get along with a lot of people, and so I don't ruffle feathers, and I don't see that much conflict.
Does that mean you're a people pleaser?
I think so.
Oh, you think so? And
yeah.
you're okay with that?
Yeah, I'm okay.
Okay. Do you feel that you are run over by people?
No.
Or do you feel bad, or it's like you have a different approach to it?
Yeah, I don't think I'm run over people. I don't let people take advantage of me. I know what's right and what's wrong, or what feels right and what feels wrong, and I can handle that. So
you're a nice guy.
I think so. I hope so.
We have a very nice chiropractor here. So
thank you.
So I guess, what is wealth in your experience then? I mean, I know you're a chiropractor, you're a doctor. Doctors do good job. I mean, good. They have good life.
Right.
Especially in the United States.
Yeah.
So.
Well, wealth is not just money. It can be success. There's all kinds of rewards. There's relationships. There's other things that you enjoy in life, to be able to do those things, whether it's family or...
But do you like wealth? Do you like money?
Oh, sure.
Okay.
Oh, sure.
Okay.
Yeah.
I just want to make sure.
Yeah. Oh, yeah.
Okay, good. So I'm on my last leg of questions, which is, what is the value of gratitude in your life?
Oh, gosh. Gratitude. Well, that's important too. As a doctor, I appreciate when my patients appreciate me.
Okay.
And I'm very grateful for that. And I do get that feedback because I see them a lot. And so I've had them tell me. I've had other people tell me. I've had you tell me. And that's, I'm grateful for that, I mean, it keeps me going.
That's good. Yeah. That's good. So I guess, as being in your profession and being, the way you are, what's the value of time for you? It can be taken literally, like your appointments and all, and otherwise, as a person in this world. How do you want to take that?
Well, I have, in my work day, I have appointments. I have patients, and their time is valuable and my time is valuable. So we try to make it flow every day, so that we're not spending too much time in one place. However, my home time and my relaxation time is just as important to me. That balance is so key.
Do you get, nervous or frazzled when things are not on time?
A little bit.
Not too
A
much?
little bit. There are ways I can speed it up a little if I have to. I try to give all the patients all the time they need, but sometimes I have to say, hey, I have to move on. My staff keeps me on time, which is good too.
That's
so,
good. That's good. Good. And in any other sense, the time on this planet, the time
yeah,
that
absolutely.
how do you take that?
Well, time is precious. I'm not getting any younger, and I try not to waste time. I try to learn and be involved in things. And on the other hand, it's okay to do nothing too. And just kind of daydream and meditate or be bored or whatever. I mean, I think life's too short. So if we just work and work and work and just rush and rush and rush, that's no good either. But I try to be up prompt when I go places and meet people and things like that, like here.
Yep, thank you.
You're welcome.
You were.
That's important. Your time is important too,
Yes,
and I try to recognize that.
That's
Yeah,
respecting others. Yeah.
Exactly.
That's very important. In other cultures, they don't do it intentionally as the disrespect, but the cultural value of time is different.
Right. And
so
some people are just like that. They don't value that, or they don't respect that, and they're always late, and they're always. Your time's not important. I could show up 15 minutes late.
Yeah. All right. So, would you like to talk about what is the purpose of your life? I know you have been a chiropractor.
Yeah.
Is there any other purpose?
Just being a good guy,
Okay.
helping people.
Uh-huh.
I love healing people.
Okay.
Like I said, I enjoy going, and I feel great when I leave every day. But also my home life too. I mean, that's just as important.
Okay. Okay. Good. Thank you. Now we definitely need a very well-tuned message of hope from you.
Well, I think I am an optimist, so
Okay.
I do believe things always get better.
Okay.
You have to work at it sometimes. I do believe the world is improving all the time. Sometimes that's hard to see,
Yeah.
especially in some of the political arenas these days.
Yeah.
But, there's other places to see it.
Do you get too serious about the news? Or how do you take that? Or do you not watch at all?
I like to stay informed, but I like to turn it off as well.
That's good.
And do other things that enrich me. I don't want to hear that all the time. It's overwhelming.
Okay. Nice. Glad to have a hopeful person sitting across me, huh?
I try.
All right, my last question.
Yeah.
What lights you up?
What lights me up? Personally, there's some things I love to do in life. I am a scuba diver.
Oh, okay.
And I go once or twice a year.
Oh, you
which
should have
isn't
told
a
us
lot.
more before.
I'd
Okay,
love
now.
to do more of that, but it's an amazing thing. It's a great environment to be in. It's very relaxing for me. It gets my adrenaline pumped, and when I see the fish and the coral, and I really enjoy it. And I get to do it with my son now, who's old enough to do it with me, so that's enjoyable. But also being a father, I really love going and watching my son play baseball as much as I can. That's my happy place.
Wonderful, wonderful. Well, Dr. Joe, thank you so much for coming.
You're welcome.
Thank you
Thanks
for your
for having me.
conversation. Yes, wonderful.